now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi, folks. Hey, folks, I'm bringing you good news today. Yes, I'm bringing you good news in the health department. You know, I'm telling you about our health and departments here in the greater Hazleton area, and I'm telling you about raising the bar. It's just amazing what's going on with the Lehigh Valley Health Network. You're in for a good treat today. They're growing, folks, in the greater Hazleton area. There's a new service line that they're offering here in Hazleton. We're going to talk about it. It is in the cancer area. And today I'm very happy to have on the show Dr. Michael Evans. He is a hematologist and an oncologist, and he is going to tell us a lot of great things that are happening in the greater Hazleton area. Hey, doctor, thanks for coming on the show. Sure, thanks for having me. So tell me, you married?
Yes.
Any children?
I have a 9-year-old son.
A 9-year-old son. Yeah. Now, how long have you been in the Hazleton area?
I have just recently started. Actually, today is my second day on the job.
Is that right?
So I'm getting to know the area.
Well, that's good. I'm glad you came on, because I think what you have to bring to the area is fabulous, okay, just talking to you before the show. Tell me about Michael Evans, who you are and where you come from, because, you know, we want people to know who you are, so when they do call you, they'll say, yeah, Mike, I'm glad to hear that you have that, you know, that background.
Sure. Yeah, I'm a Pennsylvania guy. I grew up in the Lehigh Valley, actually, in Emmaus, Pennsylvania, and so you know, went through high school there, and then went to college at Bucknell, also in Pennsylvania. So I've known a lot of people just from back in those days who are from northeastern Pennsylvania, and you know, so after that, it was on to some more training and medical school, and bounced around from Boston to Connecticut to New Jersey to Maryland, and then finally, more recently, landed in Hershey, Pennsylvania at the Penn State University Medical School there, where I was practicing for the last 3.5 years. And you know, at this point, I felt like it was time for me to move on from that, and so had a great opportunity here to join the Lehigh Valley Health Network and practice here in Hazleton.
So let me ask you something, Mike. When I was in high school, I wanted to be a radio announcer, and then I wanted to have businesses, and so finally you start developing different things, and then I ended up with television. Okay, what made you decide? You know, when did you decide you wanted to become a doctor, first of all, and then what area, going into the specific area, which I think is great?
I think I was pretty young when I wanted to be a doctor. It's really as far back as I can remember. I have wanted to be a doctor. So I don't know exactly what it was that made me come to that conclusion.
Is your father or mother anyone doctors?
No, my mother always wanted to be a doctor, but you know, she is Asian, actually, and so she grew up in a very strict Asian family, and it was her father and elder brother who didn't think a woman should be a doctor. So she always wanted to, and I think she probably had some influence on me to pursue that type of career. But I think for me it happened early, and I can't even remember an event that made me think that, but the idea of helping people has always been important to me.
Is your father involved?
He's not a doctor. He's in business.
So that's, you had a focus and a passion to become a doctor. So now you go into medical school, all right? And then, you know, I'm assuming all doctors have basic medical classes. What then did you decide to go into oncology and to hematology?
There's really two things that were the biggest motivators for me to go into hematology oncology. One was, you know, I like to help people who really need a lot of help, and so depending on the type of medicine that you're in, it can be variable. I mean, certainly we're always most subspecialties are dealing with sick patients, but you know, patients who get a diagnosis of cancer are I think particularly in need of help, and I think I have the kind of personality and ability to relate to those patients and help them through a difficult time. So that was one aspect of it. The other aspect of it, which probably came first, was you know, learning about molecular biology, you know, going back to college, and then I did some postgraduate research in molecular biology, and so that really feeds well into hematology oncology. It's one of the subspecialties in medicine where we really understand diseases down to a molecular and genetic level, and that's always been fascinating to me, and it's I think what made me very interested in hematology and cancer medicine.
You know, innovation is a great thing, okay? I mean, we have it with our technical equipment here. I mean, they'll come in every week and say, there's a new camera out, there's a new this out, you know. Now, control rooms, they used to be, you know, 20-foot wide or only, you know, 3-foot wide based on, you know, technology. When you started in medical school, okay, in learning the new things that are happening, and as we talked before this show, there's so many great things happening in development of cancer and helping cancer patients. What did you see in your schooling, Mike, from, you know, as you were learning each year?
You know, actually it goes back to a little bit before medical school. I was taking classes and doing some laboratory research up at Harvard Medical School in Boston. And they had a visiting lecturer who was the doctor who cloned the sheep. And after that came out, there was a lot of excitement, and the buzz was that, you know, it will be in our lifetime, and certainly in my career, that cancer medicine really moves forward. And at the time, they were talking about potentially curing a lot more cancers. And so even before medical school, I think that was already in the back of my mind, that it could be really a great time to be involved in cancer medicine. And then, you know, going through the rest of medical school, that really kind of continued to play out in that way. And you know, even to this day, we're seeing brand new treatments that are quite different from previous treatments for cancer that are very effective. So our arsenal for treating cancer is really expanding and improving all the time.
The question sometimes people have is experience in the trained eye, okay, of anything, you know, of any person. You know, when you're in it for a while, you have experience, etc. Now here, you know, you've been, not that you're new, but you're relatively, you know, 3 years, 4 years in practice. How do we convince? How do you tell me that as a young doctor, okay, coming in the field of hematology or oncology, that you have the experience or knowledge? Because there's two things. You have knowledge, which is sometimes more important sometimes than experience. I don't know. I mean, what would be some of the concerns?
Well, I think when it comes to you know, being a good doctor, there's a few things that play into it. I think one is just being a good listener and understanding people, and knowing how to talk to them, and knowing how to explain things to them, and understanding what their goals are. And I think some people, you know, it really comes down to personality and how people take on that part of being a doctor. A second part is certainly, you know, understanding the disease and understanding the treatment options. And you know, my career to this point has been very you know, heavily academic, and I've been you know, practicing medicine at 3 different medical schools now. And you know, most recently at Penn State Hershey, we were always actively participating in research and actively enrolling patients in clinical trials with brand new treatment strategies and brand new potential treatments. And so I think, you know, having that background really has left an impression on me, where it's very important to make sure that we're applying current treatment to patients. So, you know, on the one hand, being you know, only about 4 years out of my own training, you could say that might be a lack of experience, but at the same time, I think it means that I'm very current on the current treatment. Someone who's 20 years out of training might still be treating patients according to treatment guidelines from 20 years ago, and you know, that's kind of a double-edged sword there. Yeah.
So in terms of, you know, the body and different things. Many years ago, you know, when you had, you know, they have the big C, you know, they were afraid to mention the word cancer. Now it's just a matter of, well, you got cancer, it's like having a cold. Not that's similar, but I mean, it's a common thing. I don't think anybody wants to hear you have cancer. The point is, in northeastern Pennsylvania, our cancer rate is higher, I think, than, you know, an average. Why that is, I don't know. You hear different things. But so now, when you're talking about your personal, and a person is telling you, or the doctor says, well, you know, you have cancer, okay, is it a death sentence?
That's a very important question. I think that's really the way that I approach every new patient, is to, you know, first of all, you get the diagnosis of cancer, but not all cancer is created equally. You know, you can have some cancers that are more indolent, meaning they're growing less quickly and they might not even require treatment right up front, versus other cancers that are more aggressive. Obviously, stage of cancer is also very important. And so if somebody's a lower stage, you know, it hopefully is not a death sentence, and they might be, you know, someone who benefits from surgery, resection of the tumor, and then some additional treatment in the form of chemotherapy or radiation, versus somebody who presents with a late-stage cancer, where it's already spread to multiple different organs. That's a different story. And so a point that I always try to get across to my patients on the first visit is to understand what their disease is and what it means to them. And you know, for some people it means, you know, we'll just watch this. We don't even need to treat this. We'll just continue on surveillance and watch and see how fast things are changing, and treat only when we need to. But for other patients, it might mean that you know, we have you know, a few months and don't have many effective treatment options. Most of the time it's somewhere in between, where we do have treatment options, and it's more important to explain the goals and what kind of benefit we can expect from the treatment.
Well, sometimes when you hear a person, you know, they went to the doctor and they were told, you know, after examination they have whatever cancer, you know, and it's in the 4th stage, okay, and it's like, you know, did that person have any symptoms before that? I mean, or it just happens? I mean, that's like 4th stage. I mean, the point is they just went to the doctor and they were getting a pain or whatever. I mean,
it can be tough. You know, it really depends on the type of cancer. You know, if the cancer is arising in some organs, you know, like the pancreas, for example, or even the lung. Cancers can grow quite a bit before people become symptomatic, and so often when they do start to develop symptoms, they're in a later stage.
Well, how do you prevent something like this? I mean, is there?
Well, it's important to see your doctor routinely. Don't miss your appointments. Don't miss your routine cancer screening, colonoscopy, mammograms.
Does blood work for people who are going once a year for their? You know, I go every year to get all the blood work and exams. Is this does blood work indicate something that could be something going on?
You know, there can be some changes in the blood work for certain types of cancer. I think that you know, routine blood work, if there's something abnormal, you know, it can suggest that there's cancer. There's no simple test that tests for all cancers that can really lead you in that direction. So it's more important to just don't ignore symptoms. See your doctor if you're not feeling well. Make sure that you stay up to date on your cancer screening. And,
okay, so now you have, it's a new service line, not new into Lehigh Valley Health Network, but Hazleton here to try to keep people locally, which is great. You know, we have to travel out of town. Your suggestion then, in getting a message across, all right, is the fact that certainly definitely yearly exams are important. We come to age groups right now, okay, and when we're looking at our area, it's predominantly older, all right. So I would think 100%, okay, anyone could get cancer, I understand that, but 100% of the age groups, where are the majority of them coming from, age groups?
Well, typically as you get older and older, the rates of cancer go up, and so that's what we're seeing, you know, across the board as the baby boomer generation is starting to get into their 60s, 70s, 80s. You know, we're seeing a lot more cancer, you know, across the country. And that's true for lung cancer, you know, bone marrow cancers, colorectal cancer. It's really true across the board. The older you get, the more common cancer becomes. And certainly if you have other risk factors, you know, smoking history, things of that sort, that only increases your risks of developing a cancer as you get older.
Okay. Folks, I'm talking to Dr. Michael Evans, new to the Hazleton area, certainly not new to his profession. He is an oncologist and also a hematologist. We come back, we'll talk a lot more. This is interesting, folks. How do you prevent certain things? But his number, if you want to call him for any questions at all, 570-5014-LVH. That's Lehigh Valley Health Network. It's 501-4LVH. We'll be back right after this. Welcome back, folks, to the Sam Lesante Show. It's part of our health shows with the Lehigh Valley Health Network. My guest today is hematologist and oncologist Dr. Michael Evans. He says, why I became a doctor. I find this interesting, Mike. My goal as a physician who treats cancer patients is to add days to patients' lives, but even more so to add life to people's days. that's quite interesting. It shows the character that you have in terms of dealing with people, you know, and like I said, when someone's told they have cancer, you know, God knows what goes through their head. So they have that initial shock, okay, and you know, and here at this particular point is where you, Dr. Evans, comes into the picture, okay. So in terms of your patients and structures, what would be the procedure then? You know, someone has cancer, they call you, and what happens then?
Well, the first meeting is always very important, and so I hope that patients will come with family members that will be able to help them through their challenging time. But the most important thing for me is to identify the problem, say what it is, and say what the treatment options are, and that can be anything from you know, a pill these days to more aggressive treatment that might combine surgery with chemotherapy as well as radiation all at the same time. So it can be pretty variable, and as you'd expect, the patient's difficulty getting through the treatment can be pretty variable depending on what type of treatment we're providing. So for me, it's really to get the patients to understand what they're up against first and foremost, and then to understand what are appropriate expectations.
So here's a question. You hear stories where people who are diagnosed with cancer, and the first thing people will say, well, you better go out of town. Okay, you better go out of town. You go to Philadelphia, go to New York, make sure you get a cancer, you know, a specialist in what they do. And people, you know, they want the best, okay? So why do I come to Dr. Evans in Hazleton, all right? Because here again, sometimes the mentality is get out of town, okay? And fortunately, throughout the years, from shows like mine, we're letting people know about, we got excellent quality in all areas here, okay, in the greater Hazleton area. I mean, in all areas, we have great doctors. What do you tell a person like that?
Well, you know, I've seen that situation from the other end, you know, over the last, you know, 5-7 years. Being at an academic practice in Hershey, a lot of my patients would be coming for that second opinion. They'd be coming from a pretty great distance, and sometimes it's not a majority of the time that we have something that we can offer in the form of a clinical trial in a university medical center that would be different than what you would get in the community. But much of the time, it's really the same treatment. And what I think is unfortunate is hearing that about 50% of cancer patients in Hazleton travel, you know, 45 minutes an hour for their treatment. And I think that's unfortunate because, you know, what I was getting at with the different types of treatments, it can be easier to handle or harder to handle. And if you're already fighting a cancer and going through chemotherapy and not feeling so well, to add pretty frequent trips over an hour to get your treatment, you know, especially when it's probably not necessary, I think is an extra.
A majority of the cases aren't.
Yeah, a majority of the cases aren't.
I mean, if you felt that there's something there that they needed something that you could not do in Hazleton, and which is a small part of the majority,
right,
you certainly would send them to where
absolutely. Yeah, that's what I would recommend to a family member if it was something that you know, there was a unique treatment that was available somewhere else that we didn't have in Hazleton. I would be the first to make a referral either to my former colleagues in Hershey or to other people in Philadelphia or New York. But that really is the minority of patients. I think most patients, and we would see it on the other end, patients coming for a second opinion and saying, no, what your doctor's recommending, your local doctor is appropriate treatment.
Okay, so someone has cancer now, they're getting treatments, and they're concerned about the treatments, no matter where they're getting the treatment. Can I call you and say, doctor, I'd like to find out, I'm having this treatment, you know, not that I'm not satisfied, but just to get, you know, because you're new, you have all these new technologies that you came in, and sometimes, you know, there's things on the market. We're always looking for something that may be better. Mm-hmm. Okay, maybe not, but maybe better. Can I call you and say, doctor, I'm having this treatment, etc.? Would you listen to me? Or?
Yeah, absolutely, absolutely. Those are important questions. I think you know, when you're going through treatment for cancer, it's important to feel good about the treatment you're getting. You know,
not that the treatment they're getting is wrong. I'm
right.
I'm trying to think that, you know, I'm always looking. If you have cancer, I'm always looking for something that magical pill that may be out there.
Yeah, I mean that's often a little bit of a misconception with patients. You know, there is new drug development, but these drugs need to go through a routine in order to be FDA approved as new treatment for cancer or any other disease. And there's different phases of clinical trials, from phase 1, phase 2, phase 3, and depending on how well the new drug or treatment strategy is performing in those different phases, it gets closer and closer to approval for treatment. And so a lot of the time, you know, you have to be careful what you're getting, and you really do need guidance from your doctor when participating in clinical trials, because there's a big difference in the optimism most of the time when it comes to participating in a phase 1-2 trial versus participating in a phase 3 trial. The phase 3 treatment strategy will be a lot closer to trying to see if we've got a new, better treatment. The phase 1-2 trial would be much more experimental.
You know, sometimes history, backgrounds, they're in the 80s, maybe in the 70s or 90s, early 90s, there could have been some doctors that really made, which happens in all areas, okay, misdiagnosis. I know one friend of mine, a doctor told him that they had to cut him from here to here to get rid of the cancer, and he wasn't going to be able to smile, he wasn't going to be able to do anything, and the guy was a nervous wreck. So we decided, my wife decided to go to someplace and talk, and the long and short of it was nowhere near what that doctor prescribed, okay. Those are scary things that happen, Mike, okay, and thank God that we have the doctors like you out there in oncology and hematology that could give us the correct, looking at it with a more trained eye and experience. You know what I'm trying to say? Because people, especially, we have stories. I mean, you know, you hear about this guy, he had the cancer here, and I've seen, I've known of some people who have fourth stage, and they're living today.
Yeah, I think that's an important point, and you know, I guess a good way to describe it is volume. If you see a lot of a particular situation, you become better at treating it. And so for the example that you give of somebody needing a very extensive surgery, or being told that they need a very extensive surgery, if they saw somebody who saw more of that type of tumor in that location, they probably have better experience with it. And that's why I'm very happy to have the affiliation with the Lehigh Valley Health Network, because we have doctors in Allentown, which is a larger community, larger medical center, who will see a lot more of that volume.
And they're top shelf.
Top shelf.
You know, they're top shelf. Which is, that's why I'm excited. You know, because I've been promoting our local doctors. I think our healthcare system is second to none, really, in the entire area, no matter what it is. We have great facilities here in the greater Hazleton area, and for that matter, servicing, like I said, we're from St. Clair up to Mountaintop. We have a lot of viewers. It's important to know that at least we have the quality care, superb care that we have here. I'm talking to Dr. Michael Evans, folks. He is now up here in Hazleton, and his phone number is 570-5014-LVH. It's a new service, not new to Lehigh Valley, but new here. My email is sam@ssptv.com. And of course, to watch any of our shows, all of the health shows we have from Lehigh Valley Hospital Network, we have them all on our website, ssptv.com. Just click on Sam Lesante shows and you'll see them all. So in closing, Mike, what do you have to say to our area here about you?
I would say that I'm very happy to be here, and I agree with you. In my short time here, getting around to see all the facilities and all the other medical providers in the area, there are some excellent doctors in the area and excellent services in the area, and I hope the viewers will understand that there's a lot that we can do, and we know what we can do and what we can't do, and if there's something we can't do, myself in particular, I will be the first to make a referral to another area if I think a patient needs it.
Well, I like you, Michael. I think you're going to do very well. I think you're very personal. I love your why I became a doctor and adding people's lives and making the quality of lives better. And I think that has to come from the heart, you know, and when you have a person like that, it's important.
Yeah, that is very important to me. Quality of life is very important in cancer care, and it's certainly very, very important to me.
And your son's 9 years old, you said?
He's 9 years old, yes, Cameron.
And is he enjoying the area? I mean, this 9 years old, just getting adapting, making friends?
Yeah, he's a very active 9-year-old.
Yeah?
Yep.
I'm sure he's proud of his daddy. And your wife?
Yep.
She's
doing well as well.
That's good.
Yep.
Well, welcome to the area, and I wish you the best. His phone number, folks, is Dr. Michael Evans. Great guy. 570-5014-LVH. Give him a call. Certainly, we don't like to hear if a person has cancer, but if you do, address it, get better. See you next time.